All right, time now for Better Pets.
And Valentine's Day has us thinking about all matters of the heart.
And today, when it comes to pets we love, we want them to be heart healthy.
Dr. Andrea Dennis of the Bloomfield Animal Hospital is here to talk about that. But first, we're going to talk about some broken hearts because we just want to say thank you to Dr. Andrea Dennis. It's strange synchronicity, but he helped us with both of our cats, with Luna and with...
And my Charlie.
And they both
passed
had to
within
go
the past 2 weeks.
and pass on. And
that's
they were both very young.
You know, the compassion that veterinarians have to have. You do this about, you say, on average about 3 times a week.
Right.
It's such a very difficult, and, you know, thank you to you and everybody in this profession, because it's a life, and, you know, part of life is death, and you have to deal with this with each different family that comes in. So
you do, and but it's not just the veterinary staff, you know, the technicians.
Right,
I mean,
everybody.
they become part of the family, and then to have to say goodbye, and then to watch the pain of the owners is just a whole different level. But that's what the thing we can do is, as veterinarians and veterinary staff, is help you get through it and do the right thing for your pets.
Right.
Thank you for your really sweet card. Exactly. That was so nice. Thank you so much.
Like Paul waited outside. He was like, and then they heard the wailing, because I was so upsetting.
Right.
So upsetting.
Yeah, and I think you have to take, it's not for everyone to necessarily be there. You know, I remember even giving Dennis the choice, you know, was he going to stay? But I think Dennis stayed for you.
Yeah, that's it. Paul was like, I'm going to be here for you. And I'm like,
I think that's what happened.
I wanted to stay. I felt like I owed it to her. She was only 3 years old, so I thought I should hold her when it happened.
Well, let's talk about keeping our cats and dogs healthy. I mean, obviously, we're doing the best that we can. We're talking about heart health today. Yeah,
you know, Valentine's is on the way, and it's almost like when people, it can be a silent killer.
Get these cuties.
Aren't they adorable? Speaking of kittens, guys, but that's so important, is that you don't necessarily know if your pet has heart disease.
Yeah, I would never know.
No, and that's why, you know, going to see your veterinarian, we've talked about this at least once a year, if not twice, because there's things that we actually pick up with a stethoscope when we listen to the heart. We're listening for the heart rate. We're listening for if there's any murmurs.
And blood pressure, too.
Well, blood pressure, that is another little contraption that we have.
Look at that.
Yeah, that's...
that's so cute.
Well, it's hard to keep a cat calm while you're taking their blood pressure. Same thing with the dog, but it has a little cuff that fits around their little wrist there. And it's really very, very important to do that with the blood pressure. But if we don't do those examinations, you just don't know if anything else going on.
Do they have the same heart issues that we do?
Sometimes, but not so much like with cholesterol and plaque buildup.
They have a better diet.
They have a much better diet. Much better diet. And for example, in cats, if you don't have them on cat food, if you say, sometimes people say, does it really matter if I give my cat some dog food? There is an especially amino acid called taurine in cat food. So if you feed dog food to a cat, that will affect their heart.
Isn't that interesting?
Or some people that feel like, oh, my cat only needs protein, I'm just going to feed it steak and chicken. I've had many of those cats go into heart failure because they don't have that amino acid taurine, which is in cat food. So that's extremely important.
We have, first we're going to see what a normal heart looks like. Let's take a look at this. So this is a normal-sized heart?
Right. Now, the black part is the lungs, and then that white circle, semicircle in the center is the heart. And that's a normal size for a dog.
All right.
And that's, you know, again, I'm usually taking an X-ray. This is a dog right here. And I'm usually taking an X-ray because I hear something that I don't, like a heart murmur, like I'm hearing a heart rate like over 200 rather than 100 for a dog. And then when I see something abnormal, then it's definitely time to take an X-ray. Now look at the size, that thing on top, that is the heart. Yes, and we call it a basketball size heart. And then look at it side by side. You've got this regular heart on your left and the enlarged heart on the right. So there's many things that we're going to do next in terms of trying to determine what's going on.
Now, I have to apologize because I originally thought this segment was about heart-to-hearts in comparison, and we have a picture of that as well.
Of course you do. Because I'm old enough to know what that's all about.
Thank you, Dr. Dennis.
But the thing is, when you do recognize heart disease, moving on.
You know I like to get you.
I know.
Every segment.
It's Friday and there has to be a little humor around here.
Exactly.
But I'm bummed. Okay.
But the thing is, this is not a death sentence necessarily.
No, that's good to know.
You can give medication.
We can definitely do medications, and because a lot of these animals will go into something called congestive heart failure. So with that, sometimes you use diuretics, but like anything we've talked about here, it's preventing it. If it's not congenital, meaning they're born with it, because there's certain breeds like dogs, like Newfoundlands and Dobermans that have heart disease, but if we can prevent heartworm disease itself.
Heartworm disease, and that's a pill, literally.
Right. Or sometimes there's a topical too.
Okay.
But for cats and dogs, they both get that disease. So if you could prevent your guys from getting that, they're not going to get heart failure from that. The other thing is there's a disease in cats, older cats, called hyperthyroidism, where their hearts beat really, really fast, and that's treatable. So again, I think going to your veterinarian, making sure you have the stethoscope, the physical exam that the expert can help guide you with.
And that's why we should see you. As a reminder, Dr. Dennis is the owner of the Bloomfield Animal Hospital on Old Windsor Road in Bloomfield.
And on alternating Saturday afternoons from 2 to 3, she's taking your listener questions during Pet Talk on WTIC 1080 Radio.
Is this on Saturday for you?
No, I'm off. There's a basketball game.
Oh, okay.
I'm
all right. Tune in next Saturday. Absolutely.